Let's bring the judges of the Better Wellness Challenge finals up. We have John Dole, Gary Binstock, and Bill Haas. Let's bring them up with a round of applause, everybody. You remember this gentleman, John?
Hey, thanks for doing this.
Absolutely.
Yeah.
Glad to be here.
Hey, nice to meet you.
John, you want to sit in the middle? In this side? Sure, mine.
Yeah, all right, we might as well. Not anymore.
So what exactly are we looking for today as judges? This is a big responsibility. What are we actually looking for? John, you want to kick it off?
I'm looking to be impressed with an idea that's innovative, well thought out, and has a high probability of success.
All three of those things.
All three of those.
And is that the truth for you too, Gary?
Yes, but I would add the people part. I want to get to know the founders as people and what's in their head about scaling their company and what ultimately drives them.
Did you hear what Gary said? He wants to get to know the people behind the company. I've had an intuition that that is generally important. Do you agree that the people behind the thing is important?
I think it's both. I think the idea has to be really, really solid. There's lots of money out there to support great ideas. You have to have the leadership to execute and bring forward the technology or whatever it may be. I think what I'm going to be looking for is we have cancer and we have social determinants of health, two very, very critical areas that in healthcare we're facing every day. So I have to believe that their concept, their idea, is really going to be something that will be sustainable in our healthcare delivery system.
So Bill says he wants to see both. You want to see the people and the idea. Is one of them a deal breaker? If the idea is so-so and it's a great person, are you out? Or vice versa, if the person is so-so, but that's a killer idea, are we in?
We don't have any so-so people here, come on.
Well,
These
not
are
here,
finalists.
certainly.
Come on.
I'm talking about the bigger picture, for, above and beyond, not even just here. When you're talking about people and ideas.
I think, so LabCorp, we have a big venture fund. We do a lot of investing in a lot of medical technologies. So sometimes when we invest in a company, they need different kinds of leaders. They need different components to really help them get to that commercial stage. So I think it may not be, you have to have that quality leader. But I think as long as they are willing to complement themselves with other skill sets, other expertise, I think that's, that can happen.
Wonderful. Thank you for all that insight. Bill, Gary, John, let's bring the moderator of the entire event here. It's Aaron Price. Let's bring him up.
Hello. Are we good? Yeah, there we go. Sorry to be a little behind. Turns out I got like a whole bar mitzvah thing happening over there. Good to see everyone. Nice to see you all. Thank you for joining us. So we talked on the other stage about these challenges representing momentum in the region and creating real opportunity, not just giving away the cash prizes, but also having the opportunity to accelerate market development. And so I'm very pleased that Tech United is able to bring these to life, that we can bring this opportunity. We just gave away 50 grand on the other stage. Excited to do the same thing here. So that each company is going to have a minute to pitch. We'll do some question and answer. They'll deliberate, and we're going to give away two $25,000 awards. So looking forward to that. Thanks again for being out here. So the first one up is, yeah, we should clap. I'm down for the clap. My in-laws are in the audience. You have to make me look half decent. The first one is Geoponica. Are they virtual or live? Someone yell it to me. Virtual. So, behind you, in fact, if you wouldn't mind, those two chairs just scoot down. Maybe, John, if you wouldn't mind just going to the other side, we'll have enough room to see the virtual. Is he there? Pro show, we good? He's there. Love technology. Here we go. You hear us? Hello.
Yes.
Great. When you're ready, you got a minute.
Minute? I thought it was 90 seconds. I apologize.
We'll give you 90. Go.
Appreciate it. So good afternoon, judges, panelists. Thank you for this opportunity. My name is Desmond Hayes, the owner and founder of GeoGreens. So I'll get right into it, gentlemen. We have a problem, and that problem is providing and getting more nutritional foods to minority communities and food insecure areas. Right now, New Jersey itself has 8 million people. The population in the world is 8 billion, with projection to be 12 billion by 2050. Now, our solution here at GeoGreens is to address that as aggressively, basically as possible through our indoor farm hydroponics technology and the produce that we're offering, specifically microgreens, which are known to be 40% healthier than the average leafy green. And the way we're going to be able to do that, guys, is our implementation strategy of learning and teaching, and also accessibility and engagement. Learning and teaching meaning, outreach to the local communities between working with colleges and institutions, Rutgers, Richard Stockton College that we've been working with, working within local restaurants and supermarkets, and holding tours within our facility right now that I'm sitting in right now as well. And on the second side of that, obviously, guys, is the accessibility and engagement, which I was speaking about a moment ago. Working with USDA and the SNAP program, formerly Food Stamp program, which we were lucky enough and very, very excited to be a part of in the enrollment of this exact program and implementing that into the culture. Also working within the assisted living community facilities as well within areas. We're located in Hamilton, New Jersey, and we're working with Hamilton Community Care right now to get our product in there as well. And last but not least, guys, is we're focusing on implementing and pumping a delivery-based subscription of our produce within the community, known as a CSA as well. Those are, again, I know my time is running short, guys, but I just wanted to say one last thing. And I heard a gentleman mentioned a little while ago about partnerships. And we at GeoGreens also are very, very happy and very embracing of our partnerships. We're working with a company that specifically works on seed breeding, which is specific for indoor farming and produces the maximum amount of yield and less pathogens and contaminants, which is a great story for healthier greens. We're working with another company that's specific in working with growing medium, biodegradable growing medium that's revolutionary. And then the third company that we're working with is...
but we got. Sorry, I know there's a little delay here. Unfortunately, we got to cut you off, but we'll do some Q&A, and you can try to squeeze some of that in. That did go a bit into your Q&A, but question?
Sure. Thank you for that. Do you plan to build and manage these indoor farms, or you're licensing the technology? How would you plan to scale?
Oh, yes. Well, right now, the facility that we're in right now, we actually inherited, but the plan is just to scale this facility. We're working out of a 2,000 square foot facility, and it's fully automated. So I essentially need to be here only to monitor the plants once or twice a week, make sure nothing is leaking and harvesting and packaging. And I don't have to be. I work predominantly remotely on my iPad to make sure lights turned on or on a proper feeding schedule and so on and so forth. So the plan, again, goal was to have 2 or 3 of these locations. I'm in Central Jersey right now, another in the north, another in south, to focus primarily on the opportunistic food insecure areas that are populated everywhere, but more so on the west side of the state, the Mercer counties, the Camden counties, the Gloucester counties down in the south, and several other ones up north as well.
All right. Unfortunately, we are out of time, but thank you very much. Hang out because we're going to bring you back in a little bit for some other Q&A. Give me a round of applause. If you heard me on the other stage, we talked about how when startups come up here and they pitch their idea, they're very exposed. It's kind of like having a baby and holding it up and be like, what do you think of my baby? And most people are like, your baby's ugly. So we have to encourage these people and give them a lot of love. So give me another round of applause for him and for our next presenter, which is going to be Baby Safe. Is Baby Safe real, virtual, or live? Here. Sure. You're here. Where's Baby Safe? He's coming on up. You got to clap him up. Here we go. You
standing here?
No, you come all the way up here.
All right, cool. Oops, sorry.
I'm going to try to hold you closer to that 90-second rule.
Yeah.
That's okay.
Nice
You're
to
good.
meet you. Nice to meet you. And nice to meet you, sir.
Go ahead.
All right, we're all good?
We're good.
All right, so hello. My name is Fozan Amjad, and I'm the co-founder of Baby Safe Health. Healthy pregnancies are vital to a healthy world, and inequities within our healthcare system threaten the health and wellness of pregnancies for all women, especially women of color. Within the United States, for every 1 white infant death, 2 black infant deaths occur. And in New Jersey, my home state, our home state, disparity is even worse, where 3 times as many black infants die as white infants. 3 times. This is a result of social determinants, such as lack of accessibility, education, socioeconomic status, and language barriers. And New Jersey and the rest of the world needs a solution that puts information and accessibility in the hands of mothers to empower them during this pregnancy process. Baby Safe Health is a Rutgers student-based startup that aims to reduce these infant mortality rates and decrease the racial health disparities by providing mothers with an all-in-one platform to support them during the pregnancy process. Our solution is a free mobile application that connects mothers with a symptom tracker, a doctor's office finder, and a proprietary machine learning algorithm that takes in information from the mother and outputs data-driven insights of the potential health consequences that might occur during the pregnancy. Our solution will give economically and socially disadvantaged mothers the information that they need to feel empowered and in control during their pregnancy process. We have built an iOS application, and we partnered with University Hospital in Newark to bring this solution directly to mothers. And with your support and through partnerships with healthcare providers and nonprofit organizations, we can decrease these devastating infant mortality rates, first in New Jersey, then the rest of the world. Thank you.
Good job. Question? John?
Yeah, thank you. Thank you for what you're doing. Looked at your website. You look better in person. Thank you for being here in person.
Thank you.
2 questions. How many people are using the app now? And what do you think the biggest barrier to getting more folks on it?
All right, so we've developed the iOS application, and we've sort of brought in research from our customer research initiatives with University Hospital. However, we actually want to use a lot of the funding some of the funding for beta testing to make sure that the solution is efficient as well as tackles the problem that we want. And then what was your second question?
So what's the biggest barrier to getting in people's hands?
Sorry, I can't hear you.
The biggest barrier to getting the app in people's hands.
The biggest barrier, it's really just, well, first of all, we wanted to allocate some of that funding towards an Android and web application to sort of further that development or that scope that we can reach. But the biggest barrier is actually sort of contacting these healthcare providers, contacting these nonprofit organizations, and presenting them with a solution that we have and showing them that the solution is efficient, does tackle the racial health disparities by providing it for free. So that's our biggest barrier, just simply finding that market within the healthcare providers and the current market that we have with the nonprofit organizations, bringing it to them, and then they'll partner with them, and we'll partner with them to bring the solution to them.
Any other questions?
So this is a free cost to the consumer. So is it the healthcare provider that's providing this to essentially lower their costs, or also donations and et cetera?
Yes, certainly. So there are 2 streams of revenues. One you did mention was the donation or the grant aspect of it, but the other part is that we aim to partner with maternal companies, diaper companies, a lot of the companies that are prominent in the pregnancy market as well as the baby market, and providing like advertisers for them. We also want to offer ad-free app licenses, of course, but certainly our 2 main sources of revenue are going to be grants as well as ad revenue.
Thanks.
So LabCorp recently just bought a company called Ovia. It's a digital platform, and they were a venture fund company of ours, and so we would be whatever happens here, we'd be very interested in talking with you about what you're doing. Because to John's point, you need to scale this, and that is not easy in healthcare. You have to have a platform to scale with. So just keep that in mind.
Yeah. We are looking towards partnering with local governments as well, finding the areas of our country. We're starting with New Jersey because that's just the closest, but we do want to scale this to the rest of the United States, and that comes with partnering with local governments, even like, the state governments as well, so that we can find their respective demographics. And of course, like you said, scaling that is not easy, but certainly it is something within our mind. Like, it is a path that we'll take.
Excellent job. I think you're starting with New Jersey because it's the best, but
Of
great
course,
work.
Of course.
Big round of applause. Next up is Ponz Tech. Is Ponz virtual or is Ponz here? It'd be great if I knew the answer to that question. Ponz is virtual. Great.
Hey.
Whenever
We're sorry, we're playing.
Hi, can you hear me?
Yes, we can.
You're good.
Whenever you're ready.
Then I am ready. Hi, everyone. I am Soner from Ponz, and we are converting the 50-year-old traditional ultrasound technology to become a consumer product so that medical imaging can be performed anyone, anywhere, instantly. Today, one of the biggest problems that hospitals are facing are the high readmission rates. And 40% of those readmissions are happening not following up discharge orders and regular visit back to the hospital, especially from people that are living far away in rural areas, but also low-income communities. So in order to overcome that problem, we are developing Ponz, which is an AI-driven machine vision system that is integrated into mobile ultrasound probes. And it starts basically analyzing and giving feedback to the doctor of the medical image that is performed remotely. It starts autonomously image extracting, reconstruction of the image, but also doing the risk assessment. But we also have a very important and interesting feature as well, which is the navigation feature, that the system is navigating the end user so that anyone will be able to provide and to use the probe to move in her or his body and perform the medical imaging, connect with their doctor remotely, and perform the assessment. And we are heavily focused on providing the technology to especially people that are living in low-income communities so that they have access to affordable and decent, but also fast healthcare. And we are a team of two, myself, my twin brother, and three full-time employees that are working. My brother is also a professor at Rutgers right now in UBC and head of smart surgeries and diagnostics labs. And we have over 20 publications in the field. And our goal is to develop a technology that will make medical imaging possible no matter where you are, and connect with your doctor and perform the real-time assessment of the medical images, especially on internal medicine and women's health conditions. And thank you.
All right, questions?
So how are you thinking about regulatory approval for your product?
So in our case, we are basically staged as class 2, and we are basically doing the pre-assessment. We are not position ourselves as diagnostics tool, but doing the monitoring and risk assessment on the field. And therefore, we are class 2 and staged as a software as a medical device, which has a shorter roadmap for the FDA approval, but we will still need the FDA approval as a software as a medical device.
One more question?
I just wanted to clarify. So is this a DIY that can be done in the home, or you're going to your local doctor? And if it is something that's got a DIY component, have you tested that with actual patients, and are they following and able to actually perform the procedures?
Yeah, so the idea is basically either you will have it at your home or a nearby pharmacy without needing going back to the hospital or to the clinic or to the doctor, so that you can connect remotely. And yes, so we have done a couple of trials, especially adding the navigation feature changed it, because right now people are feeling more safe to use the props because the system is basically navigating them, but they are always connected remotely with the doctor simultaneously as well.
Thanks.
All right. Good job. Thank you very much. Round of applause for Ponz Tech. And the last company pitching is Kyothera. I had a feeling the fancy suit meant he was coming on stage. Big round. Remember the ugly baby thing? You got to clap him on here.
Okay. Awesome. I'm on. Set to go? Yeah, you're good. All right, awesome. I'm Marc, the CEO of Kyothera, here to tell you about our mission towards curing incurable cancers. So our story started about a decade ago when my uncle was diagnosed with metastatic cancer. was a diagnosis that opened my eyes to a relatively unknown patient population that's in desperate need of help. You see, we often talk about cancer survivors, but for patients with advanced cancers, there's not really any survivors. There's really just how longers. And that is because despite more than 220 cancer drug approvals over the last century, patients who are diagnosed with metastatic or advanced disease live on average about 11 months after their diagnosis. And that is a problem that is begging for a fresh solution. So at Princeton University, my lab embarked on a fundamental discovery campaign and identified a new node that cancers rely on to suppress the immune system. Using next-generation drug approaches at Kyothera, we've since developed an exceptionally potent therapy that is on the precipice of going into IND-enabling work and which is able to potently reactivate the immune system to destroy cancers of many different types, including triple-negative breast cancer, sarcomas, melanoma, and then several other of the solid tumor types. And so this is a therapy that's tremendously exciting to stakeholders in the cancer community. From patients that have no curative options to physicians that have no alternative therapies to the pharmaceutical agencies that have tried and failed to develop immune reactivating therapies. At Kyothera, we're about a year and a half or so out from dosing our first patient in the clinic. And we've assembled a team of former med chemists from Merck and Boehringer Ingelheim, skilled oncologists from CINJ, as well as Farber and Columbia, and then numerous other exceptionally skilled personnel in the area with the hope of bringing new hope to patients with terminal disease. And that's everything. Thank you.
Questions? Bill, I'm going to put you on the spot. Question?
Yeah, very, very impressive. I read what I could read. It seems like you're hiding some of your technology. I actually did a cancer startup, so I have a lot of experience. I have a lot of respect for what you're doing. But I wanted to get into some of that, some of the detail of where you're headed. I think you're doing the right thing, surrounding yourself with a lot of thought leaders in cancer. I could tell from what I read. So I think that's really good. Funding is really important. So we're talking. I know this is a small grant in the scheme of what you're really going to need. Maybe can you speak to maybe what you're thinking about to get to that year and a half out? Yeah.
Yep. Yeah, we're currently in late Series A discussions right now with the intention of raising about $15 million. 6.5 million of that's going to go into the IND application, and then the remainder will go into both the pharmacodynamic enabling studies as well as that early phase 1 clinical trial. And we already have groups at UPenn, Columbia, and Farber willing to write and run that phase 1 trial with a focus on TNBC as well as 3 subtypes of soft tissue sarcoma.
Can you tell me how your therapy would be different from existing ones, like checkpoint protein?
Yeah, that's almost a layup for me, so
Cool.
that's
right
a great
ahead.
one. So CTLA-4 and PD-1 have provoked tremendous responses. Response rates in the first line is about 18 to 28% in lung cancer, melanoma, and then a few others. What we have is actually we're going after one of the master immune regulators that Bristol Myers, Eli Lilly, and Allergan tried to drug in the early 2000s, but they failed because they targeted the wrong component of it. And our work at Princeton University identified a new node in that pathway that's actually dominant over that immune suppression. It's orthogonal to PD-1, and actually we're expecting that in certain cancer subtypes we'll combine with PD-1.
I understood maybe 20% of that, but I think it sounds like you've nailed it.
Yes, we have an orthogonal therapy that will combine or work as a monotherapy with the immune
John Dahl, the
checkpoints.
CFO. John Smartus. What's the name mean?
It's actually from martial arts. It's the phonetic spelling for KO or knockout. So knockout therapeutics is what it comes from.
Awesome. Good job.
Thank you very much.
Congratulations on making the finals.
Thanks, everyone.
So, I want to highlight that these programs with Tech United are meant to do exactly like Bill said here, right? Whether you win or not, this is interesting. We'd like to get involved. That's really the point of this. It's not so much the 20. There's 2 $25,000 prizes is a fantastic short-term win, but really it's about how do we bring people together? How do we unite the community to really create opportunity for these organizations to thrive? So I'm so pleased to hear this kind of feedback, and I want to thank John and Robert Wood Johnson Barnabas for sponsoring this Tech Challenge. It's a big deal. It's like mediocre applause. I think we could do a little better than that for them. I mean, they kind of, there we go.
Am I supposed to clap for myself?
I don't know.
I'm not
You
sure
just sit
either.
there, you look good, you're doing great. Here's what's going to happen next. You guys go off stage and deliberate. They're going to pick one Rutgers-related startup to win one $25,000 prize, one non-Rutgers startup to win the other $25,000 prize. I'm going to talk to the startup founders for a few minutes while you deliberate, and then you'll come back up and announce the winner. Sound good?
Sounds good.
All right.